A risk allowance is generally given to employees working in dangerous environments. In this case, the frontline medical staff are exposed to and are at risk of contracting the coronavirus pandemic on a daily basis. They are therefore of the view that as frontline workers, they deserve to receive at least a minimum fee in the form of a risk allowance. The Executive Director at the Ministry of Health and Social Services, Ben Nangombe, however, says the ministry has started with consultations on the issue.
The question of whether it's, I want to call it risk allowance or honorarium, speaks to a change in the condition of service of an individual. And if you are talking about a change in the conditions of service, you need to involve other stakeholders. And that is the consultation that is ongoing.
Since the outbreak of the virus, 2 frontline medical personnel have succumbed to the virus, while about 400 have contracted the virus and are in isolation and quarantine facilities. During the current state of emergency, the Health Ministry employed an additional 2,905 medical staff to strengthen government's response towards the virus. The medical staff also claimed that most of them have not yet received any salaries, neither overtime worked on public holidays and Sundays.
If it is such that there is a staff member who hasn't been paid, possibly because capturing the data of these individuals on the system in order to be able to, for a salaries to be processed, that there is a delay in that regard, that has not been brought to my attention. But if it is such that there is such a thing, we are definitely going to address it, and so that we can process the salaries on time.
Nangombe acknowledges that the medical staff are performing a high-risk duty.
We don't want to have health workers who are putting their lives at risk every day, and we are not attending to the basic need, such as the payment of a salary.
The medical staff at the clinic on Saturday morning closed down the country's busiest testing facility after the Regional Health Directorate instructed them to vacate accommodation establishments at which they are isolating. The instruction was later nullified by the ministry's executive director. Emil Sebeb, NBC News, Windhoek.